We are visiting once again with the team from Apple, Addison Partners for Play, Learning, and Education. Joining us once again is Mary Haley, the project manager and director of Apple here in the community. Hi, Mary. Thanks for coming in today.
Hi, Don.
Good to see you again. And would you please introduce the guest that you have brought with us to the studio here today?
Yes, delighted to. This is Joel Hara.
Hi,
He
Joel.
is with DuPage Health Coalition.
Very good. Well, welcome.
Thank you.
It's nice to meet you and nice to have you here, and certainly as a part of the Apple team. Tell us about the DuPage Health Coalition, if you would, please.
Sure.
Well, it's founding in the DuPage County area, and a little bit about the people that you serve within DuPage County.
Yeah, DuPage Health Coalition is also known as Access DuPage. The community knows as Access DuPage. It was incorporated over 20 years ago. And kind of the premise of its inception was to see an influx of families moving in the area that did not have health care and accessibility to it. So Access DuPage, prior to my time, was created, and it has, we as an organization provide health programs, health insurance for low-income, uninsured, and underinsured families in DuPage County.
Can you give us a snapshot, a demographic snapshot? How many people are we talking about as a percentage in DuPage County that may be in need of those types of services that you just described?
You know, it's a good question. I don't have an answer to it, but I will say it is said that it's over 50 languages spoken in DuPage County. Mm-hmm. And with that, it presupposes that it's a high influx of families that can qualify for these services. And a lot of those families that are in this area, new arrivals, are in the process of adjusting the immigration status. Either they don't have documents, or they're asylum seeking, or they are refugees, or parolees, or families that are invited by a family member to be in the United States. So they're in the process of adjusting the immigration status, and they cannot access health care. Mm-hmm. And that's where some of the programs that we offer come to be a great resource for them.
They are tandem issues. They are the issues that a family or an individual is dealing with regard to immigration status. They are new to this country.
Correct.
Like you just gave a whole list of, under certain conditions.
Sure.
And tandem with that, alongside it, is the problem of healthcare and the inability and the inaccessibility, which is why your coalition exists.
Correct.
Okay.
Yeah.
Now, do you have outreach in DuPage County? How do people find your services? Is it through clinic facilities, or how does that work mechanically?
Yeah, so we partner with pretty much all the hospitals in DuPage County and federally qualified clinics in DuPage County. So in fact, those could be intake sites for families to be registered for any of our programs. So let's say somebody goes to Good Sam or CDH and they don't have insurance and they need the health care that they need, or they can be registered to any of our programs. The fastest way for people to register to our programs is our office. It's in Carroll Stream, 511 Thornhill Drive, Carroll Stream, 60188. We're open to the public Tuesday, Wednesday, and Thursday. That's the fastest way, because it doesn't matter where people get registered for our programs. In the end of the day, everything has to be channeled through our office, and therefore sometimes people miss a form or a signature. Yes. and so on and so forth. But if they come to our office, they can get registered on the spot. Mm-hmm. and receive Access DuPage card, which is not a health insurance, it's a health program that functions like a health insurance, and folks have access to health care in a very affordable way.
If a family were to go to, let's say, an emergency room,
Sure.
or maybe even a doctor's office, clinical setting, if they have that card, is it easier then for them to get whatever services they're seeking then?
Yeah,
because
absolutely.
They've been registered?
Yeah, so maybe let me give you a little backdrop. So Access DuPage is not a health insurance, it's a health program. And families to qualify, they need to live in DuPage County, and they qualify by income guidelines. We use the 250 FPL as a benchmark for them to qualify. And to register, so those are the qualifications. And to register, they need to provide a picture ID and also proof of address that live in DuPage County, and third, proof of income. And once they provide all this information, they receive a 1-hour training where they learn how to use the Access DuPage card.
Okay.
So it literally looks like a health insurance card They go with that card. They can go to a convenient care facility close to where they live. Let's use in Addison as an example. So I live in Addison. I go to Access here in Lake Street.
Yes.
When I go and see the doctor, I pay $5 to $15 to see a doctor. If the doctor determines that I need to see a specialist, it will cost $5 to $15. If the doctor determines that I need X-rays or some sort of a fluid
test, maybe,
test,
a diagnostic
$5, as long as is provided in DuPage County.
Okay.
With Access DuPage card, folks can go to any pharmacy within DuPage County to buy the medication that they need. Could be Walgreens, CVS, Target. So in the range, the prices will range between $10 to $50. And God forbid, if families go to the hospital, the program will be greatly reduced or possibly even for free.
Does this fill in where Medicaid would not be then? Is because a lot of these people would not be qualified for Medicaid, is that correct?
Yeah. So Access DuPage is for families ages 19 to 64. And Medicaid is for folks 42 and older. So some
you do have a gap there.
There's a gap there. So always has been a gap, and obviously some people in the community may be hesitant because it's a government program and may have some concerns on that. We have a couple navigators that have assisted families with that transition. But right now Medicaid is closed and Medicare as well. So Access DuPage could be a good resource for families to access health care in a consistent way.
Do you have people who are basically like patient advocates, either at your facility in Carroll Stream, or are there advocates in hospitals and clinical settings when somebody walks in and they just don't know how to get service? They just don't know where to turn. So are these people trained in knowing, hey, there's resources available here and yours is one of them?
Yeah. So yes is the answer. Different capacities. Obviously, if somebody goes to a hospital and they don't have health insurance, I will say 90+% somebody will say, hey, there's a program for you. It's called Access DuPage. We can help you fill the paperwork, or call this office, or call this number, kind of a thing. And pretty much could be the health department, could be any government building or office can provide that information.
Have things changed in the last 20 years or so where these services are not only are they available, but they really are trying to reach out to the community? We are understanding that this is a real need, a real concern, which is why your organization, the DuPage Health Coalition, exists. But you can't just turn a blind eye to this anymore, right? I mean, that's just not working.
Yeah, correct. Well, I think COVID, it
proved it.
It proved that. It opened the curtains and realized a lot of the brokenness in our system and a lot of things that prior to that we thought at least we can manage. All of a sudden we discovered that there's a lot of gaps in our healthcare. And and it was not even about pride or lack of resources. It's a need, and there's a resource that can be met, and we just happen to be one of the organizations that facilitate healthcare for families that otherwise wouldn't have it.
I think you might have touched on this earlier. Is language a barrier with accessing healthcare generally?
It is very much so. As I said earlier, there's over 50 languages spoken in DuPage County. I hear names that go higher than that, but not accurate. Yes, very much so, because language, culture, and accessibility, all our flyers, all our information is available in 10 different languages right now to reflect the demographics of our community. And all our staff is bilingual, English and Spanish. But if some families speak another language, we make accommodations to make that accessible to them. In some cases, there's some cultural issues, for instance, for families that come from a different part of the world, that we're trying to coordinate that, and it's cultural things, certain things that are not upheld from a tradition where they come from, but this healthcare, we're trying to make it as accessible, as culturally attuned and flexible to them to receive the health care that they need.
Right. We'll talk with Mary in just a moment, but Joel, I wonder if you would just take a moment now, address our audience in Spanish, and not that you have to repeat everything you've said over the last 10 minutes, but just give us a snapshot about the services, what the DuPage Health Coalition is, and the services you provide, and the outreach that you would want to bring through your appearance here today at ACTV to our viewing audience in Addison.
Yeah, I want to thank you again for this opportunity. So I'm going to transition into
Yes,
Spanish.
that's fine. Thank you.
Es un placer compartir con ustedes esta tarde de los programas de DuPage Health Coalition o Access DuPage. Somos una organización de fines no lucrativos que proveemos programas de salud, aseguranza para familias que no tienen seguro de salud, sin importar su estatus migratorio. El programa es gratis, es totalmente confidencial y lo más importante, el programa que no es carga pública.
Great, thank you very much, Joel. Now, Mary, we talked with some of the other health care and health-related partners of Apple in the past. Hamdard comes to mind, and you've had others here too. How long has Apple had the affiliation and association with the DuPage Health Coalition in partnership with Apple? How long has that been
For
happening?
several years. I
Okay.
would guess in between 5 and 10 years.
All right, so it's been a while now.
Yep, it sure has.
And are we talking about the real purpose behind having a health care organization that Joel represents, and their outreach to the community falls in line with promoting early childhood education, early learning, educating families and parents? There's got to be a real good fit with Apple, because if you don't have a healthy child, they're not going to be able to excel in school then,
Yeah.
correct?
Yes, that's part of the reason. And in addition to that, the other factor that's so important to us is kids are better prepared to learn if the family is strong and if everybody in the family is healthy and able to do what they want to do. So when we are working with families, we don't only talk about early childhood education and related services. We're trying to help families in any way that they may need some resources, and this is just such a basic resource that it's important to us to be able to connect families with resources like not just DuPage Health Coalition, but Hamdard and others that are part of our partnership group.
Because if kids aren't in school, it's not doing them any good, and the
Exactly.
families are concerned. I mean, if they have to get pulled out of school because either they're sick or mom's sick or whatever the situation is, then there's a loss. There's a loss of learning opportunity. And especially at the younger levels, at the early levels, that's valuable time. That's really a precious time that those kids need to be in school,
It's a
in a learning environment.
hugely important time. And it's so important that families can be focused on children's education and not have to be worried about pressing medical issues, because that's just, we can't have these competing things going on. We need families to be able to be stable and secure in issues like healthcare so that they can focus on kids' education.
Do you hear from the schools at any point when maybe they have a student that there is a chronic absence for some reason, and I don't know how intensely you get involved in that, where you could make a connection, or through the school a connection could be made? Hey, maybe the parents don't know about the services that are available, because very likely they don't.
Yeah.
Would they reach out to, would somebody like at District 4, for example, a school nurse or whoever, be able to reach out to you and say, how do we get them the information? Does that happen?
Absolutely, yeah. There is a group of family liaisons at the school district who work with each of the schools, specifically with families where kids are having some attendance issues. And Joel works with that group as well.
Okay.
So the family liaisons at ASD4 know to connect with Joel and other resources that are a part of Apple, and know how to connect families with Joel.
And then they can kind of take it from there. Access, or DuPage Health Coalition would take the handoff pretty
Yeah.
much from the school and then work directly with the families.
Correct.
Yep.
Is that
Very
right?
much
Yeah.
Exactly.
Okay. Now, how about when you go out in the community? You do your fairs and festivals and events. Are parents coming up to you and asking you about health-related issues? They might have questions about other things in relation to the kids' early learning and developmental screening and access to literacy, some of the other services you provide through the Apple organization. But do they talk about healthcare?
People
with you
do
at all?
talk about that. Oftentimes, what we are doing is being proactive and asking families
Oh, okay.
about health care. So we're trying to be proactive and talk not just about the heart of what we focus on, but some of the partner connections that we can be making as well. And DuPage Health Coalition is one of the first ones that we'll ask about on a regular basis. And there is typically interest in learning more about that.
Right, right. And again, you have family advocates an advocate and liaison right within your organization too, who maybe that might be the first stop that a family makes.
Yes.
Would be talking to you or your family advocate before they even get over to Joel's organization.
Yeah.
Right.
And Rosie Galvez, who is our family advocate, always talks about the DuPage Health Coalition along with Hamdard and other healthcare partners routinely.
Would you say healthcare is probably the number one, maybe not directly school related, but really impacts the whole family? That's probably one of the top things that people are looking for resources.
Yep.
Yeah, okay. So Joel, how do you do outreach? What's the best way to get your message out there? Because you know that if there's one family you reach, there's probably 10 that you didn't hear from. So what's the best way to at least get your information out to the community?
Well, first of all, venues like this, which I'm very thankful, local partnerships with Mary and many other organizations. And I think post-COVID, a lot of organizations change, a lot of organizations no longer exist. So it's kind of reigniting those relationships and saying this is who we are and this is what we do, presented in a way that is crisp, clear, and compelled in a way that is relevant to people. So we use any platforms from social media and in-person meetings, gatherings, school fairs, local food pantries, government agencies, faith community, all the above. This is who we are, this is what we do. If you know somebody that can benefit from those services, reach out. And we make it in a way that is, besides accessible, is hours accessible for families, and we can call them. They can fill some of our paperwork for an application over the phone to get started. If they say, I work the morning, but I'm open in the afternoon, we can kind of accommodate that in a way to reach out the family the best. But a lot of it is strengthen those relationships in the community and continue keeping them abreast of the programs and resources available.
How is your organization funded?
We, let me see. So it is funded through the health community. So basically, it started in its inception as a preventive care for families. They start seeing families come in a detriment to their health in a way that it could have been prevented. So in its inception, it started like that. Let's do something about it to provide resources. So the majority comes from that and some grants and so on.
Federal grants? Yeah.
But primarily comes from the medical community.
Well, you touched on an interesting topic right there. It's where are you going to spend the dollars? Are you going to spend the dollars in treatment, which can be expensive, because oftentimes treatment, things aren't caught until they get a little farther down the line, and then the treatments are expensive. Or are you going to put the dollars up front in proactive, preventative, routine, screening? You mentioned testing earlier. So where are you going to spend your dollar? Because that dollar can't cover everything.
Correct. And it's strategic, and it gives the best results. So it guarantees quality of life and also a fair opportunity that people have to healthcare that otherwise won't have to prevent it. So, and as much as we can to make it accessible to language and culture in a way that they feel comfortable accessing the healthcare.
Is the current showing of the migrant community, the expanding of the migrant community, especially in the Chicago area, now into the suburban area, is that of concern? Has your team talked about that? Is how are we going to serve this influx of tens of thousands of people who are coming into this country with absolutely nothing to have for shelter or healthcare or education or anything.
It's a big, I would say, an opportunity. It's a concern and it's an opportunity too, because there is also a source of language attached to it. We see it as an opportunity, and we cannot do everything, but there's healthcare we can provide for them in a way that is affordable to them in language and culture. And we obviously, many of those families are still in Cook County, so we haven't touched a lot, but definitely we have seen an influx, especially Venezuelan, Colombians, Ukrainians, Russians in the area that benefit from our programs, but the bulk of those constituents are still in the Cook County. But as they keep moving into the western suburbs, it gives us an opportunity to serve them, and we're committed to that.
Families are only going to expand. You mentioned services right here in Addison, and that's located at the DuPage Health Department building?
Yes.
That's where you're located at? Okay, right on Lake Street?
Yeah, so that's one of the site office that we work with. Our main office is in Carroll Street.
Is in Carroll Street,
Yeah.
right. Could a person get that same type of service if they go locally here to the service, the office in Addison on Lake Street?
Yeah, in fact, maybe it's a little backwards. So our office is just the administrative building. And we connect them to local clinics and hospitals throughout the county.
Because that's another thing too, is transportation and travel. I mean, these all count. Those things are all
usually
issues.
families that qualify, we connect them to a local health provider closer where they live, because transportation, sometimes child care, and so many other things that make it as accessible as possible.
Right, right. Very good. How do people reach out to you? And I'm going to ask you to give that information first in English, and then I'm going to ask you to give it in Spanish. So
Sure.
remember what you said.
Okay.
What's the best way to reach out and connect with the DuPage Health Coalition?
So DuPage Health Coalition, the address is 511 Thornhill Drive, Suite C in Carroll Stream, 60188. And our webpage is accessdupage.org. Our general number is 630-510-8720. Our office is open Tuesday, Wednesday, and Thursday from 8 to 4 to the public for walk-ins, no appointment necessary. And I will say it in Spanish now. Para acceder a los recursos que tenemos en Access DuPage, la mejor forma es nuestra dirección, el 511 Thornhill Drive, la oficina C en Carroll Stream, 60188. Y nuestra página web es accessdupage.org. Y el teléfono es el 630-510-8720.
Well, thank you very much for all the information you provided today. And Mary, as we just mentioned a moment ago, this must be a real lifesaver for you in some cases, and our community, knowing that you have such a member of your Apple team that you can refer people to and get the information that they may need.
It is very much so, and it's also great because Joel is very responsive. So when there are situations where there is a child or a family that needs services immediately, we know we can get in touch with Joel and get hooked up with the right resources quickly.
Right.
And that means a lot.
Good. Let me share another program that we have. Is a medical debt assistance program. It's a newer program for us. It is basically 1 over every 3 Americans has medical debt. And that is something that has affected all of us. And obviously for those of us that have insurance, we still have some debt, but at least we have insurance. In many cases, folks don't have either one, but still have the medical debt. We have a brand new program. Is for anybody who lives in DuPage County, who has medical debt that cannot pay it. We have a program that can help cancel that debt. As I mentioned, the only requirement is to live in DuPage County. Immigration status is not a factor to receive any of our services. In fact, none of our programs are public charge. So it's a great commodity, especially in families that are in the process of adjusting the immigration status.
Is there an income eligibility for the medical
Not for the
debt?
medical one. Yeah. In fact, in some of the other programs it is, not in this particular one.
I see.
Because families, in some cases, folks don't know, but in some cases, people that make up to 400% FPL qualify for medical debt assistance, but they don't know it, or they don't ask the hospital, or they don't speak the language, or they may feel odd to ask for those resources. But we are a non-for-profit that we launched this program. It has been very successful. We're helping families, and it's seamless, and people can come to our office, bring their bill, and we start the process. Even if the bill was given out of DuPage County, as I mentioned, the only requirement is to live in DuPage. That's the only requirement.
Okay, very good. And for information on the medical debt program, contact your office.
Yeah, our office, so they can go to our webpage. There's a link there. I will send you maybe a video for you to, to take a look of it and share as deemed appropriate.
Yeah, well, it sounds very user-friendly. It really does.
Yeah.
For a service that, people know they need it, but it can be extremely intimidating, and it can be very hard on a family to have to deal with this, especially when they're trying to do so many other things, including get their kids into school and have them be successful.
Very much so.
And that's why you have the partnership that you have.
Absolutely.
Mary, you have another big event coming up, and it's right around the time when kids are going to be looking for things to do. Tell us about your next
We do.
special event happening here in Addison.
We're going to have the DuPage Children's Museum doing a pop-up at the Addison Library on Monday, November 20th. From 10 until 11:30. There is no charge to attend the event. It's a ton of fun. We did this the first Monday or the Monday of Thanksgiving week last year, and it was very popular.
turnout,
So we're doing a second time around and looking forward to it.
Now, when folks come to that, obviously it's a lot of fun for the kids and everything, but is this also your opportunity to connect maybe with new families who don't know anything about Apple and certainly could benefit from an organization like DuPage Health?
Absolutely. We're always looking to connect with new families and doing some promoting of Apple and some of our key partners. So that's an opportunity to talk to families while the kids are playing and having a ton of fun.
Off doing their thing, right, very good. Monday, November 20th at the Addison Public Library for the DuPage Children's Museum pop-up event from 10 to 11:30, and it's free admission.
Yep.
Well, Mary and Joel, thank you very much for coming in today to be with us. This has been great information. We hope that our viewers, if you're in need of information or know of people who are in need of some assistance with the DuPage Health Coalition, this is a great opportunity to connect with their organization. Their main office is located in Carroll Stream, or you can call their number 630-510-8720 for more information, or visit them online at accessdupage.org. We've been visiting today with Mary Haley from Apple and Joel Hara, the Community Relationships Coordinator for the DuPage Health Coalition.
Thank you.
Thank you very much for joining us today.
Thank you.
Overwhelmed by medical debt? Finding yourself in this situation can be stressful and scary, but you are not alone. 1 in 3 Americans struggle with medical debt. Medical debt can hurt your family's credit, makes it difficult to afford essentials like food and rent, and causes people to delay critical health care. DuPage Health Coalition is here to help. Did you know that DuPage County hospitals and many doctors' offices provide financial assistance, even for families with incomes much higher than the poverty level? The most important first step is to ask for help. Medical Debt Care DuPage, a DHC program, makes that easier. We help insured and uninsured DuPage residents struggling to pay their healthcare bills. We'll help you apply for financial assistance and connect to resources like healthcare, medications, food, utility assistance, dental treatment, and mental health care. Every one of our neighbors deserves excellent, affordable health care, and our partnerships make it possible. Please reach out today. We can help.
¿Angustiado por la deuda médica? Si se encuentra en esta situación, puede ser estresante y aterradora, pero no está solo. 1 de cada 3 estadounidenses lucha con deuda médica. La deuda médica puede dañar el crédito de las familias y dificulta el pago de artículos de primera necesidad como alimentos, renta, y hace que las personas se retrasen en su atención médica. DuPage Health Coalition está aquí para ayudar. ¿Sabía que los hospitales del condado de DuPage y muchos consultorios médicos brindan asistencia financiera, incluso familias con ingresos más altos que el nivel de pobreza? El paso más importante es pedir ayuda. Medical Debt Care DuPage, un programa de DHC, lo hace más fácil. Ayudamos a los residentes de DuPage con seguro médico y sin seguro médico que luchan para pagar sus facturas de atención médica. Le ayudaremos a solicitar asistencia financiera y conectarnos con recursos como atención médica, medicamentos, alimentos, asistencia de servicios públicos, tratamiento dental y atención de salud mental. Cada uno de nuestros vecinos merece una excelente atención médica asequible y nuestras asociaciones lo hacen posible. Por favor, póngase en contacto con nosotros hoy. Podemos ayudarle.